Testosterone Replacement Therapy, or TRT, is often promoted as a way to regain energy, strength, and youthfulness. It's marketed as a modern solution for low libido, fatigue, and muscle loss. The appeal is clear: restore vitality with a simple treatment. But TRT comes with a serious, often overlooked risk. While it can boost energy and muscle mass, TRT can also severely reduce male fertility. The very treatment meant to make men feel younger can make it difficult or impossible to father a child. This is not a rare side effect. It's a predictable result of introducing external testosterone. For men who want children, this risk is critical. The decision to start TRT should involve careful thought and a discussion with your doctor. It's essential to understand both the benefits and the risks. Only with this knowledge can you make an informed choice about your health and future family. In this video, as a medical scientist, I'm breaking down the science and lab evidence behind how TRT impacts your sperm count, hormone balance, and even your body's ability to produce testosterone on its own. Know the facts before you decide. Testosterone is a vital hormone, often called the male hormone, but it does much more than define masculinity. It is produced mainly in the testicles and is essential for building muscle, maintaining bone strength, and supporting sex drive. Testosterone also helps regulate mood, energy, and overall well-being in men. In short, testosterone is crucial for male health and vitality. TRT is prescribed to men with clinically low testosterone, aiming to restore normal levels and relieve symptoms. It can be delivered via injections, gels, patches, or pellets, each method designed to boost testosterone in the bloodstream. Many men report increased energy, libido, and muscle mass within weeks. But here's the catch: the brain can't tell the difference between natural and external testosterone. Elevated levels from TRT trigger the brain's negative feedback loop, shutting down its own signals to the testes. The result? The body's natural testosterone production grinds to a halt. This is the critical mechanism behind TRT's most significant side effect: impaired fertility. The therapy's benefits come at a cost to the body's delicate hormonal balance. Let's look at what happens next. Once TRT enters the body, the brain senses high testosterone and quickly cuts back on GnRH. The pituitary responds by slashing LH and FSH production, hormones essential for testicular function. LH stimulates the testes to make testosterone. FSH drives sperm production. With both signals suppressed, the testes stop producing their own testosterone and sperm. Intratesticular testosterone drops to near zero, crippling sperm maturation. The result: testicular shrinkage and a dramatic drop in sperm count, often to zero, azoospermia. This isn't a malfunction, it's exactly how the therapy works. The sperm factory shuts down and fertility plummets. For men on TRT, this is a predictable outcome, not a rare complication. Understanding this chain reaction is crucial for anyone considering TRT. The next step is to see how this plays out in real-world lab results. The hormonal changes resulting from TRT become quite clear when looking at lab results. Before starting TRT, men often present with low testosterone levels, but their LH and FSH levels are typically normal or show some variability. After several weeks on TRT, we observe that testosterone levels rise, but LH and FSH levels often plummet, sometimes to near zero or even undetectable levels. This is a clear biochemical fingerprint indicating a shutdown HPG axis. Semen analysis conducted after months on TRT frequently reveals severe oligozoospermia or even azoospermia, the complete absence of sperm. A man who once had a normal sperm count can experience a drastic drop to zero. These numbers serve to connect the dots, showing that TRT reliably suppresses the hormones and the critical processes needed for fertility. For clinicians, suppressed LH and FSH levels serve to confirm therapy adherence and highlight the potential risk to a patient's fertility. The medical evidence is truly undeniable. The link between TRT and impaired fertility is backed by robust clinical research. Studies consistently show TRT leads to a significant reduction in sperm production for most men. A 2017 Journal of Urology study found 65% of men on TRT were azoospermic, no sperm in their ejaculate. Sperm suppression typically occurs within 3 to 4 months of starting TRT. The World Health Organization even studied testosterone as a male contraceptive, confirming its power to shut down sperm production. The science is clear. TRT's negative feedback on the HPG axis reliably suppresses fertility. This evidence compels doctors to have frank conversations with men about family planning before prescribing TRT. It's not a question of if, but how much and how long fertility will be affected. Major medical organizations have issued clear guidelines. Men who want children should avoid conventional TRT. The Endocrine Society and American Urological Association stress that TRT can suppress sperm production and cause infertility. Physicians are urged to discuss these risks as part of informed consent. If a man wants to preserve fertility, standard TRT should be avoided. These recommendations protect patients from unintended, medically induced infertility. The paradox: a therapy meant to restore masculinity can disable procreation. Responsible practice means considering both current symptoms and future family plans. Medical guidelines help dispel the myth that TRT is a risk-free fix for low energy. The message is clear. Ask the right questions and explore alternatives if fertility matters. For most men, fertility suppression from TRT is reversible, but recovery takes time. After stopping TRT, the brain and testes gradually resume their natural hormone production. Sperm typically reappear in the ejaculate within 6 to 9 months, but full recovery can take up to 2 years. The longer a man has been on TRT, the longer recovery may take. Regular blood tests and semen analyses are essential to track progress. Most men regain fertility, but not all, especially older men or those with pre-existing issues. The possibility of incomplete recovery is real and must be discussed before starting TRT. Patience and close medical supervision are key during this period. This is why men who want children should consider alternatives before starting TRT. Preserving fertility up front is always the best strategy. Fortunately, men experiencing the challenges of low testosterone who are also planning to start or expand their family have several viable options to consider. It's a common concern, balancing the need for hormonal support with the desire to maintain fertility. These options extend beyond traditional testosterone replacement therapy, or TRT, offering a pathway to address low testosterone symptoms while safeguarding reproductive potential. One frequently used alternative is clomiphene citrate. This medication has been used for decades. It works by cleverly tricking the brain, specifically the pituitary gland, into boosting its own production of luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH. This is achieved by blocking estrogen receptors in the brain. This, in turn, leads to raising natural testosterone levels within the body and also supporting healthy sperm production. This dual action makes it a valuable option. Another alternative is human chorionic gonadotropin, or HCG, which functions as an LH analog, meaning it mimics the action of LH in the body. This directly stimulates the Leydig cells within the testes to produce testosterone. This targeted approach can be very effective. In some cases, a more comprehensive approach is needed. HCG is sometimes combined with clomiphene or other medications. This combination therapy is designed to provide synergistic support, optimizing both testosterone levels and sperm production simultaneously. The key advantage of these alternative protocols is their ability to preserve the body's natural hormone axis, also known as the hypothalamic pituitary gonadal axis. This preservation is crucial for maintaining healthy testicular function and consequently fertility. Instead of directly replacing testosterone from an external source, these alternatives work by stimulating the body's own natural mechanisms to produce more of its own testosterone, also known as endogenous testosterone. This approach effectively addresses the often debilitating symptoms associated with low testosterone, all without sacrificing the crucial ability to conceive and start a family. It's important to emphasize that regular lab monitoring and close consultation with a specialist are absolutely essential to optimize the treatment plan and ensure its ongoing effectiveness and safety. For men who are looking to maintain both their vitality and their potential for future fatherhood, these carefully considered alternatives offer the opportunity to achieve the best of both worlds, improving quality of life while preserving reproductive capabilities. Ultimately, it's about collaborating with your healthcare provider to find the solution that is precisely tailored to your individual needs and circumstances. With the right medical guidance and a well-informed approach, men no longer have to face the difficult decision of choosing between feeling their best and fulfilling their dreams of building a family. TRT can transform life for men with true hypogonadism, restoring energy and mood. But it's not a one-size-fits-all solution, and its impact on fertility is profound and predictable. Lab data and clinical studies confirm high rates of sperm suppression and infertility among TRT users. That's why leading medical organizations warn men planning families should avoid conventional TRT. Fortunately, effective alternatives like clomiphene and HCG can boost testosterone without compromising fertility. The key is working with a knowledgeable physician, regular lab monitoring, and open discussion of family goals. The choice isn't TRT or nothing. It's about finding a personalized, safe solution. TRT isn't inherently bad, but it's a serious treatment with serious consequences. For men whose families are complete, it can be valuable. For aspiring fathers, caution is essential. Know the facts, check your labs, and explore all your options. Your health and your future deserve nothing less.